Thanks everybody for tuning in tonight. I'm Sara Manzi from the ProPlan Breeder team, and we're bringing you yet another information-packed panel discussion tonight on the Fertility Five, maximizing breeding outcomes. Before we get started, let's do a quick poll to the audience asking how long you have been breeding for. All right, so while we wait for those results, one of the reasons I love hosting these webinars is there is always something new to learn no matter how long you have been breeding. Just like science, everything is evolving, and there's always something new and fun to learn with breeding. All right, so it looks like we've got quite a bit of mix here. Starting soon, about 10%, 25% or 1 to 5 years, 13% for 5 to 10, 19% for 10 to 20, 13% for, oh, what's on there twice? 13% 10 to 20, and 15% for 30 to 40 years. That is quite the experience level there. All right, so next slide, please. So who better to talk about this than Dr. Greer, veterinarian and breeder, Miranda Peyton, breeder and founder of the fabulous Canadian online breeder shop that I frequently shop at to buy all of my breeding supplies, Breeder's Cupboard. Dr. Greer, would you mind telling how long you've been breeding and about your background?
Sure. So I graduated from veterinary school 43 years ago, almost 44, and got my first corgi when my kids were 2 and 4. So I got my first corgi in 88, bred my first litter in 1990 with corgis. I went to buy a pet corgi, and by the time I left the breeder's house, I had signed a contract that I would show her, breed her, and she would get first two puppies back. I'm like, oh, well, I'm not quite sure how that happened, but okay. And then about 11 years ago, got Danish Swedish farm dogs as well. So I've been in veterinary practice for 43 years. I work with breeder clients every day, all day. So I live and breathe the same stuff that you guys do. So I currently have a litter of puppies. I've been hand feeding one of them every 3 hours. So when I talk about this stuff, I hope you understand that it doesn't just come from the academics, but it comes from the heart.
All right. Well, I think we missed your slide there. Might have to skip 2 slides. All right. And then the next slide is Miranda. Over to you, Miranda.
Hi guys. For those of you that don't know who I am, I'm the founder of the Breeders Cupboard. I've been breeding for about 17 years. I breed Basset Hounds. I started with just a pet Basset and it evolved from there. I started the Breeders Cupboard about 6 years ago in a bedroom in my house as a hobby, and it's really grown from there thanks to all of you. Um, it's my passion. I love this. I talk to you guys every day on the phone, help you with your issues, and enjoy your good stories about the successes you've had. So I'm excited to be here again with Dr. Greer and ProPlan and see what we can all learn.
Awesome. All right, so we're going to break up tonight's discussion into the 5 Ps of fertility: progesterone, prenatal care, puppy count, preparation, and of course, planning, plus a few minutes about what ProPlan and Breeders Cupboard offered breeders. We're going to be answering questions at the end of each topic, so please feel free to ask your questions during the topic in the Q&A box. We're aiming for about an hour, hour and a half, depending on how many questions we get. And just a note that this presentation is intended for educational purposes. Please speak to your veterinarian with any concerns about your own dogs and puppies, especially when dealing with these types of challenging situations. Also note that the views expressed tonight are reflecting the speaker's own personal opinions. Next slide, please. All right, so a little bit of Q&A and housekeeping. We're a big group today, so we're going to keep everyone on mute during the presentation, but please do put your questions in the Q&A box as we go, because we will be jumping in and asking your questions. We won't be doing a general Q&A at the end, so we ask you keep your questions to the topic covered today. Please take a minute to notice the difference between the Q&A box and the chat box. So we're only going to be pulling the questions for our presenters from the Q&A box, but feel free to use the chat box to connect with each other during the presentation. So with that, I will turn it over to Dr. Greer to kick us off.
So we started this discussion a couple of weeks ago talking about what we wanted our topic to be. And probably 2 or 3 years ago, I had a moment in the exam room, as I do often, where I had some frustration with clients that weren't getting as successful of outcomes as they could have been from their breeding program. And so I sat down and said, okay, what are the 5 things that I can tell them to do that's going to make a difference in their outcomes? Getting the female pregnant, keeping her pregnant, successfully having the litter, scheduling things, all the bits and pieces, like what are the bare bones that we need to do? And I came up with these 5 items, which we turned into the 5 Ps, just so it was a little bit easier to remember. So the first is progesterone testing. And I think a lot of people underestimate the importance of it. For many years, we've bred dogs without progesterones. Dogs bred themselves. And gosh, dogs still do breed themselves. We have accidental breedings that, of course, if the dogs plant it, the bitch always gets pregnant with a dozen puppies. And if you plant it, they get pregnant with 2. So it's a little frustrating from that perspective. But progesterone really is the backbone of knowing not only when to get her pregnant, but to get her unpregnant as well. So we need to start progesterone testing early enough in the heat cycle to see where she's at. Because if you wait until day 14 and you come in with a 22, I don't know if she's at 22 and has been there for a week, or if she's at 22 for the last 2 hours. So we need to start it early enough to know where we're at. And then we need to continue testing beyond the ovulation point. A lot of people get to a 3 or a 4 in the nanogram scale, which would be basically 9 to 12 on your scale of nanomoles. And then they quit and they're like, well, she should ovulate tomorrow and everything should be fine. Well, not all bitches do that. Several of my own get to that number and then they stall out. So you want to do enough progesterone testing that you don't break the bank, but enough that you have a nice idea of when she ovulated, when she started her heat, and when she's due to have her puppies. It's not just important to keep her there for the breeding, but also to know when she should whelp and when you should schedule a C-section. And you may say, well, I don't really need that information. My bitches always whelp on their own. Everything is great until they don't. And until you end up in a high risk pregnancy situation where you have a bitch that gets sick, or a bitch with 14 puppies and you need to schedule a C-section, or a bitch that's pregnant with 1, or some other of those things that happen, the bitch that's goes into preterm labor and her progesterone drops. Unless we know her due date, we really can't give you the information you need without those numbers in progesterone. The problem is we only get 48 hours, 2 days in front and behind the right day to whelp to get this right. If we're too early, for more than 2 days early, the puppies don't breathe. If we're more than 2 days late, the placentas fail. So we get a 48-hour window plus or minus to get this right. It's not like humans where we've got weeks. We have literally hours to get this right. So it's very important that we have this information. Our staff does not have a crystal ball. We really need to have some kind of numerical information to know exactly where we should be doing our breedings and where we should be doing our whelpings. And bitches are the only, well, canines in general are the only animals that don't ovulate a mature egg. When a horse ovulates, when a human ovulates, when a cat ovulates, the egg is ready to fertilize. In the dog, it needs 2 to 3 days to mature. So that means our fertile period is 2 to 3 days past ovulation. So on this graph, LH is actually the hormone that creates ovulation. It's luteinizing hormone, but that test kit is difficult to get, difficult to use. We don't rely on LH very often. Progesterone, on the other hand, typically will give us some baseline wobble. It'll go up and down. You may get a 1.2 and then a 0.8, and then you're like, oh, I missed her. No, she's just doing this until you get to about a 3. Once they get to 3, almost every bitch catches from there, rises, and somewhere around 5 is where we estimate ovulation to be, 5 or 15 on your nanomil scale. And then we want to do our breedings 2 to 3 days after that, and we can get into some detail on that. But don't call your vet clinic and expect them to have this crystal ball. It doesn't work that way. So like I said, we need to get her pregnant and unpregnant at the right time. Some of you that are old enough may recognize this movie and this scene from the movie. This is Dr. Dolittle. This is the push me, pull you. So I just want you to remember, we're timing both ends of the pregnancy, the front end to get her pregnant and the back end to get her unpregnant.
So at the Breeders Cupboard, we do have a couple of progesterone machines because I've heard from a lot of you guys that my vet doesn't have in-house progesterone. It takes 48 hours to get a turnaround, which isn't ideal for breeding. So we have the Vet Chroma, and it's an in-house machine. It's not the same as the one that your vet would have, but you have to be able to do a blood draw. It's fairly simple to use if you have the ability to draw blood. The tests are about, $16 a test. You buy them in boxes of 10. They work pretty good. They're not the same as your IDEX. The one thing to keep in mind, and I recommend this to everybody, is if you are going to buy a machine to use at home, definitely have a way to keep your samples at the ideal temperature. The technology for these home-based machines is really finicky on temperature. So if you're getting fairly inaccurate results, it's going to usually be you're not spinning your blood down correctly, or you're not having the sample at 25, 26 degrees Celsius. It's really important. I know it's a huge investment, but one thing that a lot of breeders are doing in remote areas is pulling together, and they're purchasing a machine and just leaving it at the local clinic. And then you guys at least have some numbers to go off of. But I don't recommend, if you're importing semen and using frozen, using one of these. These are great for fresh chilled or live breedings. They're going to give you an idea of what's going on, but they're not going to give you the same accuracy as, let's say, at the IDEX lab. Next, we'll go to the next slide.
And you can have your samples compared. If you do a sample on your machine and take that same blood sample to your veterinary clinic and ask them to run it, then you can start to put together a chart that gives you a correlation. So your 3 may be their 5, but at least you know those numbers.
Yeah, for sure. So we do have the OneFo as well. It's a little more affordable. It just popped up there on my slide. And then that other thing to keep in mind too is that, like Dr. Greer said, each machine has its own scale. We send ones out with the Vet Chroma and with the OneFo that have a comparison to the IDEX and the MIDI-VITUS. We've already kind of done the work for you, so you can compare those numbers, and then you know what your numbers mean and comparing, because one machine is going to say that you've ovulated at 12 and the next one's going to say 5, right? So that is something to keep in mind as well. So this slide was the same. Dr. Greer is talking in nanomoles versus nanograms. So this is an easy calculation, so you guys can, do a conversion. And again, it's a reminder that each machine is going to run on its own scale. So it's not so much getting stuck on the number when you're using these in-house machines. It's more the number for that scale and looking for that rise. And again, like Dr. Greer said, continuing to test past the rise to make sure that they continue to rise. And you're not just like, oh, they've ovulated, and stop your testing.
So progesterone is a pretty stable hormone. Once you've collected the blood and spun it down, you can save that serum or plasma in your freezer, and it's good for an extended period of time. We save all of our samples when we're timing a bitch. So the January samples in our lab are saved until the end of March, when all those bitches would have worked. So if we need a sample, we can go back and pull it out and run it again. The point being that the progesterone's pretty stable, but if you have a hemolyzed sample, meaning you had a difficult time drawing it and a lot of red blood cells broke down, or you didn't centrifuge it well, that extra background cloudiness, the redness, will confuse the machine and give you a different number. And I know the BioNote machine, which some of you may have, the later in the day you run the machine, if it's been on all day, the warmer the machine, the greater the inaccuracies we see. So you need to understand that your machines have some quirks. And if you understand the quirks, you can use those pretty effectively, but you need to use it enough. And it's going to cost you some money to do that, to run your samples on your machine and on the reference lab machines to get those numbers. But once you've got it, those are really valuable pieces of information for you to share with your veterinary clinic.
Great. I think we're going
All
on to
right,
prenatal
so
care.
let's just go back one because we have some questions. So we had a question written in about using frozen semen. Do you have any stats and recommendations in regard to best outcome when using frozen semen?
Frozen semen is a lot more difficult to use than fresh or fresh chilled. It has a much shorter expectancy of life in the reproductive tract of the bitch. Once it's thawed, it's probably only going to survive in the bitch's reproductive tract for about 12 to 24 hours. So you want to make sure your timing is excellent, absolutely excellent. You need to make sure that your bitch is in her best possible condition. So we'll talk about nutrition and some of those things, but nutrition is absolutely essential for those things. And you need to put frozen semen directly into the uterus. And that can either mean a surgical insemination or a transcervical insemination with the endoscope, depending on what your veterinary clinic has available and what you're comfortable with and what they're comfortable with. I know there are people like Stuart Mason, who's in Australia, that feel that they get more bitches pregnant doing the transcervical with the endoscope than they do with surgical. They feel it stresses the bitch less. I kind of feel it's the flip. I think we get some bitches pregnant with surgical breedings, whether it's fresh or frozen semen, that we wouldn't have gotten pregnant with a transcervical. And although we're delivering the semen directly into the uterus with transcervical, with TCI, we can't put the pressure on it. It's more of a passive flow of the semen into the uterus than it is if we have the bitch anesthetized. I can put the catheter into the uterus, hold the uterus tightly closed at the cervix, and force that semen up a little bit more aggressively. So I think we actually do get more bitches pregnant with surgical than TCI. That's in our hands, but every veterinary clinic needs to have that conversation with you to make sure that you're getting the information from them.
It'll also come down to the veterinarian and whatever they feel they're best at, right? Some will feel they're better at
Right.
surgicals versus TCIs.
Right,
So,
and you need special equipment to do TCI. It's about $40,000 worth of equipment to buy
whew,
for the TCI. So your vet clinic may not have that, but if your veterinarian is skilled enough to do a spay, they're skilled enough to do a surgical insemination. The only additional equipment they need is basically a catheter that you would put, normally it's an intravenous catheter, but you put it into the uterus and inject the semen directly into the uterus. So any vet that's competent to do a spay can do a transcervical.
okay, so on the frozen, is there a motility percent of abnormal post-thaw that you're looking for?
Well, I'm always happier with a bigger number. 80% is about as much as we typically expect. 60% we frequently see with good outcomes. Once we get down into the 20s and 40% is, it's a lot more difficult to get them pregnant. And even if you've calculated an additional number of sperm to compensate for the fact that only 20% is swimming, it's still
Mm.
not as good a quality of product as if you have that 60 to 80%. So we see dogs like Malamutes and Sammies. I mean, these are northern dogs, like they freeze like nothing ever happened to them. They thought that stuff thinks that it was just on vacation. It's great. We get some of the other breeds and they're much more difficult to work with. And the older the male dog is when they're collected, the poorer the quality of semen. So freeze early and freeze off.
Oh, that's not as great. So for TCI, is twice better or is once enough?
If you have enough semen that you can spare 2 units, I think 2 is better. It
Okay.
gives you a longer period of time over which the eggs are exposed to viable sperm. If there's only 1 unit left, or the number of units left are very minimal and that's very expensive or very difficult to get, then 1 should be enough. Different freezing centers have different numbers of sperm that they put in based on the dog. Many of them use 100 million progressively normal viable sperm at the post thaw and call that a breeding unit. Other organizations like ICSB scales it based on the size of the dog. So a toy dog may need 50 million, but a giant dog may need 250 million,
Okay.
millions sperm. Again, progressively motile, mean it's swimming on the side. Normal viable sperm at the thaw. Not what was frozen, but the day it was thawed. Now, most freezing centers will thaw out a small portion of your freeze the day it's frozen and tell you what that post thaw looks like. Not all of them do. So that's information you want. So if you're working with a veterinarian to use frozen semen, you want to see that semen report before you write the check for that big number that you're going to buy the semen. You want to know what the quality of product is that you're purchasing. And then you should expect it to be of that quality when it's thawed. So if they told you it thawed at 80% and it thaws at 20%, either it degraded over time in storage, which doesn't usually happen, or something happened during the handling, the shipping, or the thawing. So you want to make sure that you understand all those things. And most of the time when you buy frozen semen, you get 1 chance. Most breeders only give you 1 breeding. They won't replace that semen if it doesn't work. Fresh chilled or fresh semen, a lot of people will be like, yeah, if you don't get a litter, I'll send you another one 6 months from now when she comes back into heat. Frozen
Yeah.
semen is usually not handled that way.
very precious. So for the last of this, obviously we see this estimated breeding chart here, but is there a difference in when you're breeding frozen? Like what's your ideal timing for frozen?
I like to breed with frozen 3 days after ovulation. So I look at ovulation as being 5, but really 4 to 8. I like to do that 72 hours after ovulation. If I'm using fresh semen, I go 48. And I use the frozen semen 3 days after ovulation if she's over 15. Now we're currently running an Immulite. In the past, we've run the Catalyst, and then we say if it's over 20. So again, different vet clinics are going to have different guidelines, but it's typically 2 days after ovulation for fresh chilled and 3 days for frozen, because freezing semen causes the sperm to go through a capacitation process, which makes it ready to fertilize the egg faster than if it's fresh. It doesn't have to go through that step if it's already frozen. So that's why there's a difference in the number of days after ovulation that we put the semen in.
Okay, so let's jump over to our Q&A from our participants here. The first one is, should we be doing LH strips testing to determine when best to start progesterone?
You can do LH strips if you have access to them and they're not terribly expensive. If you're good with a microscope, you can probably do just as well, if not better, with vaginal cytology. And again, that's not a topic we're going to go into tonight, but if somebody wants it, we could do it another time.
So with the machines that Miranda sells, somebody is asking, how hard is it to draw the blood yourself?
Depends on your
Some
breed.
people are better. Yeah, some people are better with needles. Some dogs are better. Bulldogs are a little tricky. Corgis are a little tricky. Labradors, Irish setters, they're pretty easy. So it depends on the dog. And then you do need a centrifuge as well. So that's another $300 or $400 of equipment that you need to purchase to spin the semen or spin the serum down. Do not use your ceiling fan. Do not use the fan belt on your car. Do not use your
Our
washing machine.
our machines come with a centrifuge, Dr. Greer, so that
Good.
eliminates that. I had a lady
Yes,
actually tell me she was going to use a salad spinner last week. So,
no,
and I said, no, 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 no,
No,
you want to get a
no.
centrifuge.
no, you need a
Uh,
centrifuge. Yeah. I know. I've seen them taped to the ceiling fan, and if the cap comes off, oh, it looks like a murder happened in your house. You don't want
Oh
to have that
no.
happening.
Yeah, they come with one, so there's
that
spin it
rules
down.
that out. No murder scenes. All right.
So with some practice, most people can learn to draw the blood. If you can vaccinate, you can probably learn to draw blood, but it is not as easy as a vaccination because you have to hit the vein, and then you have to get a large enough sample from a large enough vein to not cause hemolysis. So it does take a little bit of practice.
All right. So do girls tend to follow the same progesterone each cycle, or does it vary? Meaning if there's a stall the first time and you test and breed, how likely will be a stall the next time you decide to test and breed?
It just depends. They're not always the same. So a lot of people will do progesterone testing on a cycle prior to the one they're going to breed on because they think that's going to help them predict. Nah, bitches do what bitches do. Every cycle can be different.
And they don't always read the book.
Mm-mm.
We've had some rise really quickly, and then the next cycle they totally stalled out. It's just one of
Mhm,
those things, right?
mhm.
So in the progesterone chart, when it shows to AI, should that be both TCI and IU? I don't know what an IU is, but
I use intrauterine.
oh,
So
right.
again, it depends on whether it's fresh or frozen. So frozen is done a day later than fresh. But it doesn't matter if you're putting it in vaginally or into the uterus. You can't use frozen semen vaginally and expect a good outcome. Only 11% of the bitches when you put frozen semen in vaginally are going to get pregnant. So you need to do intrauterine with frozen. You can do fresh chilled into the uterus or vaginal and have good success.
All right. Once mature, how long do eggs live? And do different breeds, say toy versus large, does it take the same time to mature?
I don't think anybody's looked at that, but according to John Verstegen's work, the eggs stay viable for 5 days after ovulation. It's the cervix that closes 2 to 3 days after ovulation that's the limiting factor. So if you're doing a transcervical insemination or a surgical insemination, the semen's bypassing the cervix, so you're getting it directly into the uterus and up into the oviducts. And I talk to people all the time that say, well, my vet's looked and said the cervix is closed. You can pass a transcervical insemination catheter through a cervix at any point in the bitch's life. When we go to our training classes at Minitube, those bitches aren't even in heat and we can pass the catheter. So it's not like the cervix has this magical ability to slam shut and not let other products come in. So no, the cervix can be bypassed at any point. So it's not, so the eggs stay viable. Bottom line is the eggs stay viable for 5 days after ovulation.
Okay. How do you feel about using frozen semen with a maiden bitch?
I think it's fabulous. Her uterus is pink and shiny and happy and ready to go instead of all beat up. Yeah, why not?
And sometimes you only have one shot. You never know what's gonna happen. We just had
Right.
a girl right now. She had 7, first time used old frozen, 7 puppies, no issues, did a surgical implant. Sometimes you only have one, so go for it.
Right. And yeah, so you don't know. You can always use the other semen later. The only thing you don't know about that bitch is what kind of a mother she's going to be. Is she going to free whelp? Is she going to be a good mom? You don't know that information, but the older her uterus gets, the more poor quality of her uterus is. Fertility drops by 33% after age 6. And we have people that come in at age 8 and they're like, I would like to use frozen semen on this really important bitch from this really valuable stud dog. And she's 8.5 years old. Can I do that? Oh, yeah. What a great idea. Can you do it? Yes. Should you do it?
No.
No. Does it work? Sometimes.
All right. So what age do you recommend to starting to collect and freeze?
For the males, as soon as they're
Mhm.
producing sperm, I think it's fine to go ahead and collect and freeze them. Of course, you want to do their health clearances before you make any final decisions on keeping them. But again, you don't always know what's going to happen. We've had dogs have tragic accidents, and beautiful dogs have been lost because they didn't have the semen frozen on them when they were young. So freeze early, freeze often. As soon as he's making sperm, you can start freezing him. And if it turns out later on that there's a DNA test that you get that you don't like the results of, or he doesn't, produce well or whatever, you can throw the stuff away, but you can't get it back. So freeze early, freeze often, and then make decisions about his breeding future after that.
All right. Yes, the video will be posted in our webinar. That was one of the questions. Some of them are getting slightly off progesterone. So I'm not sure if we want to continue down a different line or if we want to go over to
Ooh.
the next topic.
Let's go to the next topic and make sure we have
Okay.
time to get everything.
Okay.
All right. So number 2 is prenatal care is every bit as important for our stud dogs and our bitches as for people, the dogs and the bitches. This includes ideal body condition. So we don't want our females too heavy or too light. We want them at ideal body condition, and that's not their ideal competition body condition. You may want a dog that's running agility or in conformation to be a little bit leaner than you do when she's at a breeding weight. She needs to be on a really good diet, and diet is so critical, and supplements are so critical that we need to make sure that those are done well. She needs to be on appropriate preventive care, which means have her vaccinated before she's ready to come into heat. Don't vaccinate her when she's in heat. Get your rabies vaccination early if you need to. Get all those things ready to go. Heartworm testing should be done. We want to make sure that they're all tested and negative for the tick-borne diseases. We see a lot of Lyme disease, anaplasmosis, and Ehrlichia in our part of the world, and you probably have it up there as well. So we want to make sure that she's not positive for any of those diseases. And if she is, that you have time to get her tested and treated and cleared before you try to breed her, because we see some of these bitches get really sick from Lyme disease during pregnancy. And then make sure the heartworm and the flea and tick preventives are labeled for use in breeding animals. So that means when you get your products that your vet is going to send home with you before you buy them, Google search so type in the name of the product and then PDF package insert. And it will bring up that package insert that if you unfold it, it's like a map. It's like this big and you can't refold it and get it back in the package the way it came out. And it will tell you if it's approved for use in breeding animals or not. In the US, the only flea and tick preventive that's oral that's approved for breeding animals is Bravecto. And I'm sure you have different names for some of your products, so I don't want to get too far down a rabbit hole on that. But if your veterinarian isn't reading the labels, you should, and you can, by just typing in the PDF package insert. And then I'll do a search term for breeding, pregnant, you know, some of those terms, so that you don't have to read every word in the document. It will allow you to scan through it. Make sure your hygiene in your kennel is good, and make sure that you've done your brucellosis testing. We don't any longer have a good in-house brucella test, so it has to be sent to a reference lab. So make sure that you're testing far enough advance that you can get those tests sent out and get the results back before the breeding. So raw meat. This is how I feel about raw meat diets. Sort of like kissing a pig. Not sure I'd recommend it. This is one of my very favorite pictures ever. I love this because it helps to really define things for me. We have to worry about parasites spread through raw meat diets. We have to worry about bacterial diseases like Salmonella and Shigella that are spread through those diets. And in the last couple of weeks, we've seen avian influenza spread through raw meat diets. In the US, we've had Northwestern Naturals and Monarch Pet Food. Both have had cats that have gotten avian influenza from raw turkey in those diets. So at this point, I mean, I never recommend a raw meat diet, but I'm especially not recommending it with avian influenza creating a problem. The other concern, of course, is the calcium and phosphorus balance in those raw meat diets are frequently off, causing an increased risk of dystocia. Dystocia means difficult birth. That may mean that you end up with a C-section on a bitch that should have been able to free whelp if nutritionally she was more appropriately fed. So this is where we really want to talk about our performance diets. The Sport 30-20 diets are an all life stage diet that is 30% protein, 20% fat. It is about 500 calories in a cup of food. So it's pretty substantial amount of calories. You may have to cut back the amount of food a little bit by when you feed these, just to make sure that the bitches don't get too heavy during their early parts of their breeding and pregnancy. But as far as I'm concerned, this diet is really essential for our breeding animals, both our males and our females. If we're not feeding the machine that makes the sperm and feeding the machine that makes the babies correctly, we're not going to get the outcomes that we're looking for. I talk to people all day long about diet. Every day, every appointment I go into, I ask what they feed. And when we see fertility issues, it is oftentimes related to an inappropriate diet. And frequently, all we've done with some of the dogs that we've talked to, either on the phone or had in our practice, is make a dietary change. And we see a huge uptick in the ability for these bitches to get pregnant with nice size litters. So if you're struggling with fertility, this is the very first place to start looking.
So let's chat about the prenatal vitamins that we have at the Breeders' Cupboard. I get asked all the time the difference in all. There's so many to choose from. It can be a little overwhelming when you're looking to start your bitch on prenatal vitamins. The one I recommend the most is Oxymate by Breeders' Edge. It's made by Revival. It's the most comprehensive prenatal vitamin. It's got your folic acid, and it also has some herbs and minerals that also support fertility and pregnancy. So it has everything you need. I like to say start your bitch about 4 to 8 weeks prior to when you expect them to go into season, so that it kind of fills the nutritional gaps prior to that. Another one that's a good prenatal, it's a prenatal and a postnatal, is Breeders' Edge Breed to Wean. It doesn't have the herbal supplements that help with the fertility, but it covers all the bases. It doesn't have the fenugreek that the Oxymama has in it. It's not my favorite, but I tend to put my bitches on it if I'm not sure when they're going to come into heat and I don't want to have them on Oxymate for 6 months. I'll put them on Breed to Wean and then swap them over to Oxymate when they go into season. Be Strong is a B complex. That's from Breeders' Edge as well. And it's one of my favorite products that Revival makes. It's great for regulating their heats. If you have a bitch that's a little late coming in, it's been shown to help that. I had a bitch that had split heats. I put her on the Be Strong and it did help. So I'm not promising anything, but I do love it. And I tend to keep my girls on it they're from, a few weeks before their season until they're weaned. If they're on another prenatal vitamin like Oxymate, they don't need that much B complex. So I cut the B strong in half. I don't know if you have any recommendations on that, Dr. Greer, but
No, I think what you've given is pretty good information. Be Strong is how I got my job with
okay.
Revival, is I had called Revival to talk to Dr. B, from a client who had asked about a specific other product to bring her bitch into heat. And he came on the phone and he said, no, you don't want to use that. You want to use Be Strong. And the following day I got an email from them. So pretty sure that's why I work for Revival.
Wonderful. It's my favorite product. So these products are more of a herbal supplement. So they're not multivitamins. Problem Female is also a Breeder's Edge product. It's got the ashwagandha, which is proven even in humans to aid in balancing your hormones and fertility. It's a newer product from Revival, but I love it. And we've had great results with it. If you have a bitch that's missing, that's having wonky cycles, I recommend the Problem Female along with the Be Strong. And then when she goes into season and you breed her, switch her over to Oxymate. Breeder's Edge in between for her it is a multivitamin. It is great for in between cycles, but it is not a prenatal vitamin. So I put it on this slide. The Estrumate from Dogzymes is a herbal supplement. It has the red raspberry and the maca powder. It's great for uterine health. If you want to there's a few ingredients. There's no vitamins in it. It is good, as well as the Gestimate. It does have folic acid. It's meant for pregnancy, and it does have the red raspberry in it as well. So those are your options when you're looking at vitamins versus supplements. I do recommend, obviously, putting your bitch on some supplements prior to breeding.
And I'll just pop in here and say that, especially if you have the brachycephalics or a line of dogs that may have an increased risk of cleft palates or their midline defects like open abdominal wall or spina bifida, you want to make sure that they're on an adequate amount of folic acid at least 6 weeks before they come into heat. There was a study done in Poland in 2013 that showed a 50 to 66% reduction in the incidence of cleft palates in some of the brachycephalics by simply adding that supplement. So even though they may genetically be predisposed, you can reduce the risk in those breeds. So if you have brachies, make sure you're starting that 6 weeks before you expect the heat. You're not going to hurt anything by giving it. All the B vitamins, including folic acid, are water soluble. So if you give too much, they urinate them out. You're not going to cause a toxicity.
All right, so we've got lots of questions on prenatal care. So the first one is that was written into us. What brings on low milk supply for puppies, and can something be done in advance to improve how much milk is available?
So Revival's product, Oxymama, does have fenugreek and some other herbal supplements that helps to bring in the milk. So you can start that up to 3 days before the bitch is due. You don't want to start it before that. But that will help to bring the milk. The other other couple of things that I do is make sure she's drinking plenty, because some of these bitches won't get up and go to the water bucket often enough when they've got puppies. They're very engaged in taking care of them. So you may have to take something and mix it in the water bucket to make it more palatable. You can give sub-Q fluids if you absolutely have to. You can salt the diet if you have to. I have really good success with bratwurst, helping to bring in the milk. And I mean the sausages, the little sausages, they're not brats, they're brats. So cook those up, fry them, feed those to the bitches. Some of my dogs, I'll feed as much as 1 brat twice a day. There's a drug called metoclopramide or Reglan that will also help to bring in the milk. That's a side effect of the drug. And then on the human side, lactation nurses use root vegetables like sweet potatoes and oatmeal. So those are some things that you can feed to the bitch. You don't need a prescription for anything except for the Reglan. And so those are some things that you can use to improve lactation and get those puppies off to a good start, because we want them gaining from the minute they hit the ground.
All right, with Oxymate, I know it's a frequent topic that comes up about the cottonseed oil. Can you talk about that?
Yeah, there have been no formal studies that prove that cottonseed oil has created any issues. There's been a lot of anecdotal information that floats around, but we don't have anything that actually documents it. That being said, Revival has reformulated the supplement, not because we have seen a problem, but simply because of social media pressure. So it has been replaced. It is now in a different formula. So if you check your labels of the newer products, then you will find that it has been replaced. But like I said, it wasn't done from a liability perspective. It was done from a PR perspective.
Okay. And then the first question, kind of combo questions, is what do you, I guess one actually answers the other. What do you recommend for flea and tick for breeding dogs? And somebody asked about Bravecto, and that's what you had mentioned in your
Right.
presentation. That is also available here. That's what we have our girls on.
And
So the
we're
next,
going to see a new form of Bravecto coming to market fairly soon. I can't say too much about it,
oh,
but there
interesting.
will be a new form of Bravecto that's going to make your lives even easier. But Credelio, NexGard, and Simparica are not labeled for use in breeding animals. So if you use an oral, stick to the Bravecto. Merck spent the money to have it tested. We know it's safe. So please use the products that your companies that are supporting breeders are supporting. So use those companies' products.
All right. What supplements do you recommend for both dogs and bitches to preserve reproductive health in both? Additionally, is there anything you recommend to improve semen quality or volume in older dogs?
Volume is pretty hard. Semen quality goes back to nutrition and age. We can't unage a dog, but we certainly can improve their nutrition. A number of years ago, we had a client that made an appointment to come in to have their semen frozen on their stud dog. And it was a 4 o'clock in the afternoon appointment, and my staff kind of rolled their eyes and they're like, oh man, who scheduled a 4 o'clock appointment for a freeze? It's going to take us an hour and a half to get this done. I want to go home. I'm like, well, the dog's 11. He'll probably come in and have really crappy semen, and we'll be able to put him on some supplements and send him out the door and have him come back another time. He walked in the door, did his collection, and lo and behold, he had magnificent semen. So we immediately started to say to the client, not do you give a supplement, but what supplements do you give? Because it was pretty clear this dog wasn't just walking around on regular dog food and no supplements. So we do have 4 male supplements at Revival. And I don't want to get too far off topic, but we have Problem Male. We have In Between for him. We have Oxystud,
Oxystud.
and we have Get 'em Going, which is got horny goatweed in it to improve libido. That comes as a gel. You only use that intermittently. The other 3 can be used continuously, similar to the Problem Female and the other products that we have for the females. So if you go to the Revival website, they'll have descriptions on there, and that will help you select the product.
All right. Do you need to do brucella testing if using artificial or surgical breeding?
Well, the male is still infecting the female if he's infected. The female would not be in contact with the male. So, from the perspective of if this is going to be contagious from the female to the male, no, but the male could still do damage to the female. And there was a case at Cornell a number of years ago that frozen semen had an active brucella infection in. So freezing, believe it or not, does not kill brucellosis. So those dogs should be tested at least twice a year.
All right. And when you say raw meat diets, do you also mean freeze-dried raw meat?
Well, we start getting into the high pressure, gently cooked, all these different terms that people use for how they're not really cooking the food. I think the food needs to be cooked to 165 to 180 degrees, depending on the protein source. So if you go to the information on the website that tells you what the safe cooking temperatures are for food, you should look at those. And if you feel like you need to feed a raw meat diet, please buy it and then cook it to the right temperature before you feed it to your dog until we figure out the avian influenza thing. Because right now we've only seen it in cats, but that doesn't mean it's only going to stay in cats. We don't know if dogs are going to get it. There have been dogs reported with asymptomatic avian influenza, and I worry about people picking this up by not handling the raw meat diets correctly in their kitchens. So utensils, breadboards, hand washing, all those things. If you're handling these raw meat diets, you're putting potentially yourself at risk and your family, especially if you have someone in your family that's immunosuppressed, being on some of these more recently discovered medications that we see lots and lots of commercials on. A lot of people are immunosuppressed if they're on steroids, if they're on these drugs, if they're on chemotherapy, if they're very young, if they're very old. So please think about the health risks of those products.
All right. I just lost where I was in these.
Uh-oh.
How do you recommend changing amount fed based on number of puppies expected?
Oh, that's a good question. Normally, we don't increase the amount of food in the first 4 to 5 weeks of the pregnancy as long as she was at a good body weight. At the ultrasound, when you confirm pregnancy, then you can start increasing. Generally, the rule of thumb is about 10% per week. But if she's pregnant with a really big litter, you're going to want to up it a little bit more. And if she's pregnant with a smaller litter, probably less. If she's pregnant with 1 or 2, maybe 5%. If she's pregnant with a belly full, you may have to go up 20 or 25%. On the large breed dogs like Goldens and larger, we typically see a bitch gain 2 pounds for every puppy she's pregnant with. So if a bitch is pregnant with 12 puppies and she's a golden retriever, she may gain 25 pounds during her pregnancy. So she may go from 60 pounds to 85 pounds in a few weeks. Like, wow, that's a huge amount. Now, a lot of that's fluid, but it's still a huge amount of weight gain. So you really have to adjust it. My general rule of thumb is to take your hand, make a fist, and her ribs throughout the entire pregnancy should feel like the back of your hand. If they feel like your knuckles, she's too skinny. If it feels like this, she's too fat. But I try not to diet bitches during pregnancy. I don't want them losing body condition during their pregnancy, even if they do start off a little bit overweight because their blood glucose can drop. Some things can happen, but you want to keep her body condition at this. If she's the feeling of your knuckles, she needs to have her food upped. And that may mean you have to add some canned food or some people food, something else to help supplement her to get her eating.
All right. What would you recommend feeding a giant dog? The same as all stages?
If they're puppies, I will often feed a large breed puppy food, but it depends on which life stage you're talking about. If you're talking about during pregnancy, the Sport 30/20 is absolutely fine.
All right. So we've experienced low to no puppies on bitches in pet homes on grain free. Switching to Pro Plan, both puppies produce normal litters. Does grain free also affect male dogs?
We don't really have good information on that, but we know bitches need carbohydrates to grow puppies and we need carbohydrates to make milk. So you're absolutely correct on picking up that grain-free piece. Is yes, they need carbs and the grain-free diets oftentimes don't have a carbohydrate quantity in it sufficient to support those bitches. So good point.
All right. So we have a ton of questions on this subject, so I'm trying to filter through some of them. Um, we're getting a ton. I definitely know we can't answer them all. What recommended multivitamin would you use with Gestimate?
With Gestimate, I
That's
don't.
the herbal supplement. There is Dogzymes does make a multivitamin ultimate, but you could pair Gestimate with, let's say, Between would be another option,
Yeah, the
right? Because
beast,
then you're going to get your vitamins.
you can never go wrong with the Be Strong. It's a really good product.
All right. All right. So jumping down a few, should I be feeding supplements or vitamins to a breeding prospect that is currently 7 months old? I'll be waiting to breed until a minimum of 2 to 3 years of age.
If they're on a well-balanced diet like the Sport 30/20, you probably don't need supplements at that point.
All right. And then can you give Bravecto while pregnant and nursing?
It is labeled safe during pregnancy and nursing, and I have given it to my own personal dogs because when you find fleas, you have to do something.
All right. So let's go to the next topic.
P number 3, puppy count x-rays. Puppy count x-rays, as far as I'm concerned, is the second most important thing you can do to get a bitch pregnant and successfully have an outcome other than getting sperm put into her at the right time. So without a puppy count x-ray, a lot of things can go wrong. Now, if you're scheduling a C-section on your French Bulldog, you probably don't need a puppy count x-ray. If you have a Golden Retriever and you're trying to decide if you're going to do a C-section or not, and if she has 9 puppies, you're not, and if she has 10 puppies, you are, then yes, you need a puppy count x-ray. It will help you decide if you need a C-section intervention, either because she has 1 or 2 puppies, more than 9. And it also makes sure that you know before you go to bed that she's finished whelping. Because I hate it when clients call me and say, I really thought she was done and I went to sleep or I fell asleep, but I couldn't stay awake anymore. And I woke up and the last puppy was born and it was dead. That breaks my heart. So you want to make sure that you know how many puppies she's having. And I see all day long, I see pictures on Facebook of how many puppies do you see on this x-ray? Well, number one, they usually put the x-ray up facing the wrong direction. And number two, when you take a DICOM image on a digital x-ray and then it gets degraded to go onto Facebook into a JPEG, the quality of the image is such that you can't see clearly how many puppies are there. So please don't ask your Facebook friends. Please ask your veterinarian how many puppies there are. If you work with a team of veterinary staff that knows what they're doing, you can get really good x-rays. And I'm going to give you these tips that will allow you to help your veterinarian do a better job. Now, digital x-rays, that's up to them. You're not going to tell them that they have to buy a digital x-ray machine. But if you have the choice of two veterinarians and one does digital and one does film, which isn't very often anymore, most everybody's digital, then go to the digital one. So number one, take her in fasting. Don't feed her a giant breakfast and then take her to the vet because she's going to have a stomach full of food that's going to be hard to count puppies through. Number two is get your appointment early enough that you have time to walk her and have her have a stool. And if she doesn't have a stool, you can match her. And I'm assuming you guys know what matching is. Yes, no, yes. Okay. So matching means you literally take matches and you put them in her rectum. And I'm not sure who figured out that this was going to work, but it's been done for many years because in the obedience ring, if your dog has a stool in the ring, you're disqualified. So the obedience people all know that matching makes the dogs poop. So you put matches in, please don't put them in hot. You can put them in lit and cooled, or you can put them in unlit. Different people have different opinions, but you put matches in, take her outside, and I will tell you 90% of the dogs will have a stool in 90 seconds. So even when it's 30 below, you can get them to go out really fast and have a stool. And then we take two x-rays, one with her right side down and one with her left side down. I don't care if you do left and then right or right and then left, but take both views. And then you want to take it after day 55 of the pregnancy. So when I say take two laterals, I mean left side down and right side down. And then here's some examples of good x-rays and not such good x-rays. So you can see on the very far left one, there was a deceased puppy in the uterus. In the middle one, it's a really scattered x-ray. It's really hard to read. So it's almost impossible to see. This is what we see on Facebook all the time. And then on the third x-ray on the right-hand side, you can see that this is a really nice clear x-ray. And this bitch had nine nice puppies. Now, here's my example of why take two x-rays instead of one. So on this view, this is the same dog I'm going to show you in the next picture. On this view, you can see that there were seven puppies, and they don't come with numbers on them. We have to add those just so you know that we put those on with an annotation. Puppies don't come out with numbers. So on this view, we saw 7 puppies. We flipped her to the right side down, and the 8th puppy appeared. Not that it wasn't always there, but because puppies can be superimposed over each other, as soon as you shift them right side to left side, those puppies shift just enough that it showed up. So this is the difference between taking one x-ray and getting an inaccurate count and taking 2 x-rays. Now, this is an example of a bitch that didn't have an x-ray. She had her puppies on a Wednesday. She came to our practice on Saturday. She was running a fever. She looked like she wanted to die. Her temperature was 107. She had a dead puppy inside of her. This is not cool. So this is what you want to know is how many puppies should I have? Can I go to bed? Is she done? Is it safe? So don't take a chance. Work with a veterinarian that will work with you. Try to schedule your appointment in the morning so she doesn't, starve to death the whole day while you're waiting for her to get her x-ray. And get to your vet clinic. Don't come screaming in the door at the time of your appointment. Get there 15 minutes early, walk her around. My staff knows if they take the first x-ray and they see too much fecal material, they don't even take the second x-ray. They put her on the floor, they put matches in her, they send her outside, she comes back in, and then we start the x-ray process all over. So it's very important that we get good quality x-rays like this one on the right so that you get a good outcome. If you don't have good information, you can't make good decisions. Now, once you get above 12 puppies, I'm going to say it's hard to count because there's so much scatter and there's so much overlap. But if you have 4 puppies, you should know if there's 4, not 4 or 5. If your vet's telling you 4 or 5, you need to find a different vet.
All right, so we're getting great questions coming in. So some research says x-rays during pregnancy can cause cancer in the puppies down the road. Have you heard this? Would an ultrasound be better?
So those studies were from the 1960s. Now we don't take x-rays like we used to. We have much lower radiation exposure because we have digital, we have rare earth films, we have all kinds of things that have taken place over the years. So the exposure is very minimal, and 2 x-rays are not going to cause any harm. We've done this for decades and we are not seeing a higher risk of pregnancy or cancer in the pregnant bitches that were x-rayed. So I have seen it, yes. But it's old information. I don't think anything's been published since the 60s. Ultrasound is not accurate on numbers of counts. I had a dog that came in this week for a C-section. She had been very sick in the ICU at another clinic out of state. They told her they saw 2, maybe 3 puppies on the ultrasound. Well, we decided we'd deliver all 4 of them. So no, ultrasound is not an accurate count.
All right. So the next one, so this is a member, she had an x-ray that said 7 puppies, and an 8th puppy was born 7 hours later, and they didn't know there was an 8th in there.
Mhm.
All
It
right,
happens.
so
Like I said, we're
yeah,
that's good at this.
yeah. So is there a number for different size breeds that you say a scheduled C-section may be the best due to uterine inertia? For example, would you recommend a litter of 10 and a Great Dane would be safe to whelp versus 10 and a Bulldog?
Nope. No, I wouldn't say 10 and a Great Dane was safe. I wouldn't say 10 and a Bulldog is safe either. So no, typically anything over 9, we're gonna say we schedule C-sections because those bitches wear out and it's a long way down the uterus. Those puppies tend to end up coming out dead if they have those larger litters, or dying shortly after birth because of oxygen deprivation. So I'm a big fan of C-sections on big litters. We have much better outcomes.
Hmm. Hopefully you can't hear my puppies going absolutely crazy right now. But
And here,
this,
We can't.
oh, good. But I guess this pertains to C-section. So this is this mom's second litter. She had 13 puppies her first litter in 3 hours. So you just never know. She had these 12 puppies, her second litter, and she was almost 8 hours and she was getting exhausting by the end. So we had just assumed that, it would be that she'd be speedy like the first time. You just never know, from
you
even
don't.
litter to litter.
Right. But I don't know what her nutrition was. I don't know what her calcium was. There's a lot of differences that can take place in those 2 whelpings.
All right. So the next one is about matching. So do you just strike it and then blow it out and then put it in her bum?
That's what I do, but cool it. I check it on my wrist first to make sure I'm not going to burn her little hiney because we don't want to cause her any discomfort. We just want her to poop.
Yeah, yeah.
And
Okay. So on the,
please use paper matches. I've seen handlers do wooden matches. I think those are,
oh,
I think
ouch.
plastic sticks they're kind of rough on them.
Slivers.
But paper matches are really, they're not hard on the bitches. And if you really don't want to do that, use a suppository. Those glycerin suppositories work really well too.
Perfect. All right. So on the x-ray where you mentioned that there's a deceased puppy, can you point that out where the deceased puppy is?
That was actually my litter. That was my x-ray. You can see
Yeah.
the puppy between the 2 skulls, right
Like
in the
right at the
middle there.
bottom. Yeah.
Yeah.
You
So
can see it's
that
not
was
as
good
well.
information for us.
Yeah. It's not as
Yeah,
well
he
developed.
wasn't as
It's
calcified.
faint. Yeah.
We hoped, but we were pretty sure. And so we did an ultrasound and so yeah, we went ahead and scheduled the C-section as soon as we could to just keep everybody else safe.
And on this x-ray above this dead puppy, you can see the skull, right? Can you see my arrow?
Yep.
Mhm.
So there's the skull, and then you see this pocket of air. That's the
hmm
puppy decomposing. That's what the air is. So this is a dead puppy here on this x-ray. So there's different things that we can see on x-rays.
Okay. So what about a top down and then a side view?
I don't have good luck with those because if the puppies are all, if it's perfectly lined up with the backbone, you're going to miss that puppy. That's why I do 2 laterals. And I've done hundreds of x-rays. This is what works best.
Yeah. So this one, next question is kind of the same. My vet takes great quality x-rays, but right lateral and then on her back.
Mm.
So you're not
Just ask
recommending
them to
that.
take 2. Yeah, ask them to take a right and a left lateral. And if they still want to take the VD, okay, cool. But look at a few of them with them and see if they can be convinced that that isn't really all that helpful to take a VD.
All right. And then how far do you insert the matches and do you remove them?
I just insert them as far as I put a glove on because I don't want to put my finger in the rectum, but it's not my dog, so maybe you do. So I just push them in far enough with my finger, and then no, you don't have to remove them because when they pass the stool, they come out.
All right. Okay.
It's really
Anything we
slick.
can
I mean, if you've never done it, I mean, if seriously, it sounds really weird, but it really works.
Yeah. Yeah. Is there anything we can do to get puppies out faster? Had two puppies, one high, and then it took about 2 hours for her to get out, and the puppy was passed.
I use calcium gel pretty heavily to improve labor contractions, the quality of the labor contractions. Um, Oxytocin can be used with really great care. You don't want to use too much. You don't want to use it too frequently. You don't want to use it before she goes into labor. So, and it's a prescription item. So there's a lot of nuances to using oxytocin well. I worry that too big a dose is going to shrink wrap the puppies and actually make it worse. So I am a big fan of the calcium gel or the injectable 10% if you can get your vet to dispense it to you.
All right. So back to matching. Why are you lighting the matches first?
Some people light, some people don't. If you're not a lighter and you're having success with it, just
Yeah,
put
you
them
can
in
do it either way.
a package.
I
I,
didn't I didn't actually know you could light them and use it that way before. I've only ever done them non.
I don't know if it's the sulfur. I don't know what it is exactly that makes this happen. But for a while you couldn't get paper matches during COVID. So I know people were using Q-tips, and I know in the cattle industry, they just put straw in there. There's lots of nuances to this, but matches and glycerin suppositories just work really well for us. So, the jars of glycerin suppositories, they're kind of made like a just a little tube, and you just slip it in the bitch. That works well. And I do that before the TCIs as well, so that we have less fecal material in the colon and it's not pushing down on the cervix. So it's easier to put the scope in. Just little tricks that you learn along the way. Things I've learned from my really smart clients.
All right, we are getting so many great questions. I'm sorry we can't answer them all, but we have a couple more that pertain to this specific puppy count that we're going to go over before we go over to the next topic. What about bitches absorbing puppies before birth? Are you going to see that on an X-ray?
Not usually, because if they're fully resorbed, you're not going to see them on X-ray. There's no skeleton to see. If the puppy died after day 45 of the pregnancy, when calcification of the skeleton occurs, then you may see them faintly like the one that Miranda had in her X-ray, or you may not see them at all, or they may look really teeny weeny. So no, resorptions you're not going to see unless you either ultrasound or do a C-section.
All right, and then last question about X-rays. My clinic has a vertical and horizontal X-ray. Thoughts on a standing bitch for X-ray?
I don't have the ability to do that. That would be interesting. So if they want to give you a try and see what they get the best outcomes with, I think that'd be really interesting to see.
It is cool. That would be neat to
Hmm.
see.
All right, on to the next topic.
Preparation. So P number 4, prepare for an effective whelping with a complete kit with essential supplies and drugs, along with instructions on safe and appropriate use. So get your stuff together in advance. It's no longer possible to get overnight shipments from a lot of places, even if you were used to it before. There's been a big change since COVID in the ability of these places to get you overnight deliveries. Where I live, there is no same day delivery. I don't know where some of you live, but where I am, if you want to go to the store, you can, but we used to have 24-hour Walmarts. Well, there aren't those anymore. And most places, UPS, FedEx, the Postal Service can't guarantee overnight delivery. So you want to be really thoughtful about just planning ahead. And this is a real important thing for me is get the stuff you think you might need. And if you don't need it, okay, great. You have it for next time. But I had somebody that called me a couple of weeks ago. I was loading my van to go spend Christmas with my kids. And she called me from the West Coast, and she'd had a puppy born. The puppy wasn't breathing. And I'm on the phone with her saying, okay, do you have your Dealy? And she said, well, I don't know how to use it. So I'm walking her through how to use a Dealy mucus trap. And I said to her, do you have a 25 gauge needle that you can do acupuncture with? And she said, no, I don't have a needle. I said, well, do you have 5-hour energy And she said, no. And I'm like, oh man. And she lives by herself. So there's nobody to run and help her and go get something. And I'm just thinking, we're going to lose this puppy because you didn't have your stuff together. And this is a really important breeding. So you've got to have everything ready to go, organized, collected together, clean, ready to use. I store my supplies in an ice chest because then I have the ice chest to take the puppies back and forth, and it's clean and it's, it's well kept. And so I know when I go to whelp that I just pick up the ice chest and I have everything I need in one place, clean, no expired drugs, ready to go. So I'm prepared. So here is the short list. There's lots of other things that you may want to put on your personal list of getting things ready to go. But things like the oral calcium and oxytocin and the KY jelly as a lube and a hemostat, these are all things you need to have in advance so that you have them, a feeding tube, your formula. Some of this stuff you're going to have laying around the house, your towels. I think everybody has towels at their house. Many people have dental floss, but you may not have all of these supplies. So please do not wait until you're in trouble to get organized. Don't let a puppy die or don't let a bitch go into labor without your supplies, because that's just, there's so many things that you can't prevent. And this you can, you need to be prepared. Do we want to go through these items one by one, or do you feel like people just need a list so that they can address this?
Maybe
Um,
speak to the 5-hour energy.
yeah, we're getting a couple questions
Because
on what it is and what it's for.
that
Yeah,
would
and
be a good one to speak about. Yeah.
yeah, I don't know if you have that. It's the little bottles of, it's like caffeine and
Yep.
some sugar
Yep,
and
we
some
have
I think
things.
them.
we do.
Yeah. So it's 5-hour energy. You buy it at the truck stop, you buy it at the Walmart checkout, you buy it at the grocery store checkout, those little bottles, not the big 12-ounce beverage can, but the little bottle. And we have good success with that. If we have puppies that are born that are kind of gaspy, not breathing very effectively, irregular respirations, we put a couple drops of that on their tongue. It's not a prescription item like Dopram. You can just put it on their tongue. And many of these puppies will then start to breathe much more consistently and regularly. They use caffeine in horses for this. They use caffeine in human babies for this. So it's absolutely acceptable to use something like that. We used to use no-dose tablets, but they were gritty and they didn't dissolve very well. So we switched over to 5-hour energy. It's like $3 for a bottle. Don't have your bitch go into labor without one of those. That's not for you to stay up all night. That's for
Or
You
have
don't need it for
two.
the puppy though. You could
Or
just,
have two. Yeah.
they're cheap. Buy two.
The the other big question we're getting is what is the dealie? And I know you're gonna go over that, Miranda.
I am,
Yeah.
yeah.
So I'll hold that question.
Yeah, okay. And this is for like general whelping. Do you have any whelping specific to a planned C-section?
Mostly and I do have a bit on this at the end, but mostly just to have your stuff together, your supplies, so that when you decide that you need to go in for that C-section, planned or unplanned, that you are prepared with all this stuff. Because if you have a puppy in the car on the way, you want to make sure that you can resuscitate that puppy. So again, that gets back to having that ice chest packed and ready to go, is you just chuck it in the car and you've got all your supplies together. You're not running here and there all over the house trying to figure out where did I put the exam gloves, and gosh, where did I put the needles that I vaccinated with? And because I can just see this happening in somebody's life. But I have people that call me and they're like, I need an emergency C-section. I'm on my way, but I have to stop and buy gas. You
Oh
had
my God.
3 days, people. Put gas in your car. Miranda, you want to talk about this and then I'll
Oh,
follow you?
well, yeah, we wanted to just take a minute to announce that we've been working with Puppy Warmer. I know that Dr. Greer is a big supporter of these incubators. They're amazing. And they've been really difficult to get into Canada over the last couple of years. So we are working pretty hard to see if we can collaborate with Puppy Warmer to bring them to you guys, hopefully this year sometime. So keep an eye out for that. I definitely will make some announcements on social media and email if and when we get there, but we are working on it.
So the incubators have a heat source from above, and it's very well regulated with thermal control. in the temperature of this. There are two doors, it's glass, so you can see where the puppies are, the door is open, and then the heat comes from above. It's got that unit on the top where those red numbers are that you can adjust the temperature so that you can have an appropriate temperature in the incubator for the puppies. The black mat in the bottom of it has texture and it reflects the heat back. So this has been engineered by Ken Sundin here in Michigan to really effectively keep our puppies warm. And then the other piece of equipment on the right is the oxygen concentrator. And that takes, with just regular room electricity, you plug it in, and that takes 20% oxygen in room air and turns it into 95% oxygen to deliver to the puppies. And we'll put our puppies into this at C-section, at birth, run the oxygen in. And when I was standing at the booth talking to Ken one day last year, I had a client that came up and she said, I bought that last year when I was at the Louisville shows, and I put my puppies in there and they were zooming around like they were on a racetrack. Like, she wasn't used to puppies that were that vigorous at birth because of the support of the heat and the oxygen. So this does a tremendous job. It is the best incubator on the market. It's more reliable. It's going to last you the rest of your breeding career. We use this every day for C-sections. We have actually sometimes 3 of them set up on our countertop. If we have multiple C-sections going at the same time, we're going to have puppies in all these incubators. That's our standard of care.
It's incredible. Even if it helps save one puppy, it makes it worth it. I
Yes.
remember one of
Yeah.
the webinars you did a couple years ago for us. As a, second generation breeder, my mom, would whelp them and put them right on. And when we got our puppy warmer and incubator, one of them you said was, make sure your puppies are warm enough before they start nursing. So we just kind of implemented, they come out, they get dried off, their airway, gets cleared. They go into the incubator with their oxygen. Our puppies absolutely thrive after that. And it is an incredible difference to see after they come out and they're warm and they're dry and they've had that oxygen boost, what it can do for them for nursing.
Yeah, they're much more effective nursers. And then they get their colostrum, they get off to a good start. If you let them nurse when they're too cold, they can end up with the ileus, they can aspirate. So there's just a lot of reasons to do this well.
Mm-hmm.
Yeah. Okay, so here's some of we have a lot of whelping supplies that the Breeders Cupboard. We do have some whelping kits that are already put together for you guys. So if you're just starting out and you don't know what to get, you can give us a call or check out our whelping kits. But I wanted to highlight the calcium that Dr. Greer was talking about, Breeder's Edge Oral Cal Plus. It's my favorite. It's the highest calcium gel for whelping, and it's vanilla flavored. So it's really palatable for your bitches. They usually take it quite well. And I wouldn't whelp without it. It makes such a big difference. They just whelp quicker, I find, more efficiently. So the Dealy, which is one thing that you guys are asking about, they're very, very neat. They've got a little tube and a little suction for your mouth, and you put it down your puppy's back of their throat and give them a good suck, and you'll pull so much mucus out. There's a filter in there, so it's not going into your mouth. And it's basically like better suction than a ball by a long shot, I would say. Now we're having trouble getting the smaller size, the FR6. I don't know if you guys are in the States still, Dr. Greer, but we haven't been able to get them here. But we did get the FR8s and the 10s. And just to note that the FR8 is smaller than the 10, so most breeds are going to go to the smaller size. And then the large giant breeds, you might want to go to a 10, but I use the 8s I recommend the 8s for everybody. And then we have these neat thermometers, the Mela Home Pet Thermometer. They're new to the Breeders Cupboard, and they are non-rectal. So no more having to label your thermometers in your house, which ones are the dogs and which ones are for the people, which we've all done. So yeah, no danger here. So they're great. They also run on an app that will send the data real time to your vet. I haven't hooked up the app yet, to be honest. I haven't had need to, but I have used it on my dogs. And there's a little bit of a knack to getting the right positioning, but once you get it, it's pretty quick and non-invasive. So they don't see you coming with the thermometer and start spinning away from you. Because when you're taking that temperature, every couple hours pre-whelp, to wait for the drop, it gets a little bit overwhelming for the bitch. Bedding wise, we have these wellbeing box pads. They're one of my favorite products. They're non-slip and they absorb a ton of liquid. So I usually have about 4 on hand for my whelp, and then my litters. And then I use half the whelping box in vet bed for that different texture and that warmth on top of the whelping box pad. But it really does protect your floors. So we have them in 2 sizes, and they are non-dryer safe. So people get scared of that, but they do dry in about 4 hours if you just hang them in your laundry room. So don't get scared of that. And then the Oral Cal Plus powder from Breeder's Edge is different than the gel. I get that question asked a lot. It's designed to support your bitch post-whelp, her calcium needs during nursing. You can use the gel. I sometimes recommend, if you've got a little bit of gel left, to just use it for the first couple days, the first 48 hours. But after that, you do want to move to the Oral Cal Plus powder, and it's great to support lactation. And again, it's vanilla flavored. So I have Bassets, but I personally have never had a dog not eat it. So those are kind of my highlighted products for you guys right now. But again, be prepared. Scales, formula, feeding tubes. These are things that you should have. And it's really devastating when I get a call, can you get me a feeding tube today? And the answer is usually no, I can't, unless you're local. So, ordering ahead and just having a couple basic supplies really makes a difference in the long run.
Yeah, so
Yeah.
spend a little bit of extra money because you're going to save a puppy. You're going to more than reap the benefits, not only monetarily, but emotionally as well.
Mm-hmm.
Yeah.
And if you know at ultrasound that your bitch is pregnant, get prepared ahead of time. Don't be a me when I saw 15 on the x-ray and texted Miranda going, "Oh my gosh, can you get me formula before they're born? Because I know I'm gonna need it."
We did.
We
We did.
we did. She is the best. We have a ton of questions on this subject. The first one is, can neonates have honey, or is it a risk like human babies?
The risk is botulism, and botulism can happen in dogs too. So I would avoid honey. I would stick to Karo syrup, maple syrup, one of those more processed, because botulism is the risk. I would avoid that.
Okay. Does the 5-hour energy expire?
Yeah, there will be expiration dates on it, but it's usually over a year when you purchase it, and it's like $4. So if it expires, buy a new one.
Yeah. Are the Nutra drops as good as a 5-hour energy?
They're different. I don't use them as much. I don't think they have caffeine in them.
They do not,
Yeah.
but they do go directly into the bloodstream.
So
Right.
I guess
But
that would be like an alternative to the honey if you're
yeah,
trying to get
That's what I
your
was going to
energy
say.
up.
Yeah.
Yeah. Yeah, we love the Nutra drops here. So we're getting some questions about the puppy warmer. Can we buy it without a prescription from a vet? Do they come in
yes,
multiple sizes?
yes.
Yes.
Yeah, he has 3 sizes. They have a nice little
Um,
one that's gonna be good for a toy breeder or a small breed. Then a moderate size, and then a pretty good size one. There's an 18 by 24, I want to.
24, yeah, that's the one we have.
So they
And
make some.
I was going to say, Ken has a video on his website, I believe, on how to choose the correct size for your dogs.
Perfect.
I
Has there,
yeah.
this one's slightly off topic, but we were talking about it before. Has there been any research using the Magdalen squeeze in puppies used on foals that are not thriving? Saw a post on
You
social
know,
media where someone used it
That's
and it worked. Wonder if it was
I
one off.
I have never seen it used in a puppy. I've seen it used in foals. For those of you who don't know what it is, if a foal is born as a dummy foal, and that's a technical term in horses, it's not something that I'm saying something mean about, then they cast the foal, and they take a rope and half hitch all the way down its body and do a squeeze for about 20 minutes, and then undo it, and the foal will stand up and act like a normal foal. It goes from being a dummy full to normal. And they think it's something to do about like recreating the birth and resetting the brain. And there's this whole thing about it. And I've been really interested to see if anybody's done it in puppies. I was thinking about using IV tubing because we always have that laying around the hospital, and it would be smaller and softer than a rope for a puppy. I'd love to know if somebody's tried it. So if you have, email me, please.
I did see that post on social media, and I was wondering the same thing, if it would work well.
Mm-hmm. Miranda, do you know when you're going to be getting puppy warmers? Somebody's asking about possibly March when they're having a litter.
Oh, you know what? Tell them, email me, and I'll see if I can if we can help you with get it across the border before we have them readily available. We won't have them readily available. March would be the soonest. So, but
Okay.
don't wait until March. If you have a litter coming, just send me an email and I'll put you in touch with them.
All right. Okay. I'm going to sift through some of these. Some of them are a little off topic, so I'm going to try to stick to the ones that are on topic, just because we're getting close to our time. If you've been using an infrared non-contact thermometer, she thinks she's getting accurate readings, but what's your opinion on that monitor? Like, I don't know if they're
The
asking
Mela?
specifically about that one, but do you find it accurate?
Are you asking about I guess I need to know if it's the Mela. The Mela has been using, they've been collecting data and then transcribing that. So I don't know which thermometer they're using.
All right. All right. So let's go on to the next topic. We do apologize. We can't get to all of the questions. I know you guys have so many great ones.
It just means we have to do this again.
Yeah. All right. Back to you, Dr. Greer.
Okay, the fifth sounds a little bit like the fourth, but planning. I want people to think about planning a C-section if they think that they're going to need one, or at least to have a contingency plan if that happens. Planning a C-section in advance of a crisis can often mean the difference between great puppy survival outcomes and heartbreak. If your best plans to fail, your veterinary clinic can step in and turn a bad situation around. But you want to use a skilled doctor and an experienced team. So you want to know what your options are during office hours, what your options are after hours. There's you don't want to spay her at the C-section. There's just a lot of things that are really important here. So if you get that puppy count x-ray and see that there's one puppy, or you get the puppy count x-ray and see that there's 15 puppies, you need to go into contingency plan and not just hope for the best, because I'm going to tell you that that doesn't always work. Now, sometimes best laid plans fail. One of my own bitches, she had 2 beautiful litters, no problems with the first 2 of the 3rd litter. The first puppy got stuck. It was midnight. I was an hour from the clinic because I was away, and she was with me, and it was like, oh man. So I was driving like a crazy woman on icy roads. It was not a good plan, but you know, it's what life dishes you. So you have to know what your options are. Work with an emergency clinic that you know, that you understand what anesthetic they're going to use, how they're going to handle you, how they're going to handle your dog. I mean, some of our emergency clinics now, even here in Wisconsin, that were 24 hours for 2 decades, 3 decades, they're not. So it's gotten kind of scary out there. I don't know if you have the same shortage of veterinary staff that we have, but it's gotten a little scary. So sometimes you just have to plan a C-section because it's safer. I have clients that are 80 years old and they want to breed their dogs, and they're like, I can't get up and down on the floor anymore. I can't stay up all night. Fine, schedule a C-section. I'm okay with that, but plan ahead so that you have everything aligned. So some of my important things are to bathe her prior to the time she has surgery, whether she's going to whelp or have surgery. Give her a bath 3 or 4 days ahead of time. Get her clean. I don't want her damp. I don't want her wet. I don't want her upset when she goes into labor, but have her nice and clean, because you don't want to go to surgery with a dirty dog. You don't want to whelp a dirty dog. Know your dates. Know what your progesterone levels were. I had a client that came in this week and I said, well, where are your, she lives out of state. I said, where are your progesterone results? I want to see the printout from your vet clinic. I don't want to just see your calendar that you wrote stuff on, because sometimes those are off by a day. And she's like, oh, I can't find them. Have all your stuff in a binder, in a notebook, have copies of it, have it ready to go. Be organized. If you have fewer than 2 puppies or more than 9, we schedule a C-section. Communicate well with your veterinary clinic. Why are there chocolate chip cookies on this screen? You want to work with a veterinary clinic that you work well with. So in the middle of the summer, go in and have a cookout for the staff. Don't just drop off one thing at Christmas time. They appreciate that. But if your vet likes wine, if your staff likes pizza, buy them pizza in June. And when you have puppies in August and you call and say, I'm in trouble, I need help, you're going to be, oh, remember? They're the ones that brought us pizza last time, not, oh my gosh. They always call us 5 minutes before we close, and now we have to stay late. You want to be that person, not that person. So treat your veterinary team, everybody, the front to the back. Don't just be nicey nice to your doctor. Be nice to the receptionist. Be nice to the greeter. Be nice to the technicians, because they are the pathway to get to your veterinarian. And if you call and you're difficult, they will make it difficult for you. Be nice. If we're planning a C-section, we give Solumedrol, which is an injectable steroid, 2 to 24 hours before the C-section so that the puppies breathe better. Have your supplies ready to go. Have your bitch on Oxymama so she's lactating. Like I said earlier, have gas in your car, have your cell phone charger, have a friend that can help you drive so that you're not trying to whelp a litter and drive down the road at the same time. It doesn't work well. And make arrangements in advance that the clinic you go to is not going to plan to spay your dog at the C-section. Routine spays at C-section are not recommended. They are almost never indicated. I have had maybe 2 dogs that we've spayed because of uterine rupture at the time of the C-section, but in general, it's much safer to spay the dog at another time than it is to spay her at her C-section. Even if you never plan to breed her again, they can lose 30% of their blood volume the day you do the C-section, take the uterus out, throw it in the trash. That puts her automatically into shock, and that puts her at risk of not producing milk, not surviving. There's a lot of things that can go wrong. So make sure that you've planned ahead and all this stuff is taken care of so you're not at the last minute scrambling.
That's great advice. We'll go over a couple quick things. So you had on your list there Oxymama. That's something we have here at the Breeders Cupboard. It's the Breeders Edge Oxymama. It's great to help bring in milk. And a little tip that I give people, if they have a low milk production, you can give them double the dose for the first 72 hours, and it will make a big difference. I've had it help. And post C-section, they just tend to be a little slower lactating, right? So something to definitely have on hand, whether you're whelping or C-section. We have these portable, lightweight incubators. They're really affordable, and I use them to bring my puppies home from C-section. They have a heating pad in them, and I heat them up, bring them into the clinic, put all my puppies in them, put them in the back of the car, plug in the heating pad, and my puppies stay warm. I'm about an hour and a half from my vet clinic, so I don't have to worry about my puppies catching chill on the way home, and they set up in about 5 minutes. So it's something to have on hand, I recommend. And we do have an oxygen concentrator here at the Breeders Cupboard. The same idea. You just take your water, your distilled water, put it in it, and it'll give you your different levels of oxygen concentration. It's great to have on hand, especially post C-section. And then I recommend everybody has feeding tubes and formula on hand at all times if you have puppies coming, but definitely if you have a bitch post C-section, you should have those. I've come home a few times where, you know, mom's still out of it. It's really difficult to feed puppies and they need to eat after that colostrum. So one thing I can note, we do have Puppy Back, and then we have Breeders Edge Foster Care Canine, and then the GM. The GM is a goat's milk base, and the canine is really high in fat. I believe it's 46% fat, which is by far the highest fat content on the market. So especially if you have little guys that aren't doing as well, it's a good one to help boost their weight gain. And again, feeding tubes, the same thing with sizes. The smaller the number, the smaller the tube, the smaller the puppy. So we go from 3.5 all the way up to FR10. If you need help choosing your size, just let us know and we'll be happy to help you with that. But it's they're like $12. So have one, please.
They're cheap insurance.
Yeah, they're
Mhm.
just, everybody should have one.
Right. And we have a video on the Revival Animal Health website of how to tube feed a puppy. So if you type in, if you go to the Learning Center, which is the little blue icon with the graduation cap on it. So go to Revival Animal Health, click on the Learning Center, type in tube feed puppy. It will bring up a video, and it's me doing the tube feeding with one of my clients' puppies. So I know it's done correctly because I did it. And because I have a lot of other veterinarians say that that's the video that they refer people to, so that they don't have to try and teach it to you. So at 2 o'clock in the morning, if you can't remember all the steps, it's there. I will virtually be there with you. So rely on that to be helpful.
We have that on our website as
Oh,
well,
do you?
and
Good.
our learning center. Your video, it's the best video I've been able to find, so we definitely have it as well.
We did
I've
get a
watched
couple
it.
comments thanking you for that in the comments section. It's a great video to have for sure. We have
Every
a
time I have someone that comes up to me and says, I saved a puppy because I saw your video. I'm like, wow, like that's really powerful for me to hear. And I appreciate that you've been able to find it useful.
Yeah. All right. So we've got a couple questions before we get to the last part. When planning a C-section, is it important to reverse progesterone and wait for the drop? Is there a certain
It's
number you're
helpful.
looking for?
Yeah, it's helpful if you have that option. But I've had bitches drop from 10 to 1 overnight and go into labor overnight. So it has its risks, it has its benefits. Depends on how solid you are on your front end testing. If you know for sure when she ovulated, then you know it's safe. The question is, psychologically, is the bitch going to be ready if she's at a 7? I like to see it under 2, but I much prefer having progesterone at the time of the breeding than I do to relying on reverse progesterones.
Hmm. Is there anything that can be done to decrease aggression and promote bonding post C-section?
Yes. Calcium makes a big difference, even though she doesn't need it for labor. The calcium gel can be very helpful. I save for all my clients, I save placental fluid in a bowl so that when the puppies are born, we save that fluid and put it on the puppies after they're born and send that home in a little bottle because they don't go home smelling like laundry soap then. They go home with that. And one of my own bitches, I took her home. She looked at the puppies across the whelping box. She sat on one side, they sat on the other, and she's like, those, you need to go take care of those. And I said, no, these are yours. And she said, no, this was your idea. And I said, no, those are yours. So I put it on their little heads and their little butts, and instantly she went over and started taking care of them. So the calcium, the saving placental fluid, if your vet doesn't save it, grab some placentas, take them home with you. And then the Adaptil or DAP or Zenodog collars that are pheromone based can also help improve maternal skills. And so does oxytocin. So those 4 things can be very helpful in improving maternal bonding.
All right. Do you use domperidone to help with lactation after C-sections, for instance?
I have not had good outcomes with domperidone. I know there are people who like it better than Reglan. I personally think the bulldogs drool too much. My corgi bitches don't feel good on it. I prefer using metoclopramide.
All right. Thoughts on a vaginal birth after a C-section?
It is okay as long as you have a good reason. If she had a puppy that got, like it was coming down and instead of going in the cervix, it went up the other horn. If the puppy was too big, if there was something abnormal about that particular litter, then there's no reason she can't have a VBAC. But if she was a bulldog during her first litter, she's still a bulldog. So you're probably going to need another C-section. So it depends on the reason. 25% of the time C-sections are fetal in origin, 75% are maternal. So it depends on the reason.
All right. What do you feel the reason a bitch absorbs a puppy other than stress, injury to the body, or poor placement?
There's a huge list. It can be cystic endometrial hyperplasia. It can be that she had Lyme disease. It can be that she had trauma. It can be nutritional. It can be infectious, like brucellosis, like herpes. There's a huge long list. So there's not one good solid answer. If you do have resorptions and you're at C-section, then we suggest taking a biopsy of the uterus at the C-section and sending that in to see if they could find the cause. Sometimes they can, sometimes they can't, but at least you've taken a look. Now, I don't open up a bitch just to take the biopsy, but if I'm at C-section and there's resorptions in front of me, and they're gonna look really weird. They're gonna look like this gray, slimy, mucousy stuff. And it almost makes veterinarians feel like that might be a pyometra. It's not a pyometra, it's resorptions. The uterus has a thickened band, and then this gray, gooey, mucousy stuff comes out. Ask your vet to take a biopsy. Don't wait until they come out of surgery. Say, I think there were 6 on the ultrasound. Now there's only 2. Can you biopsy while you're in there? And then I send all mine to Ohio State to Chris Permerandin for biopsy because he's boarded in both Therio and in pathology. But if you can't remember, email me and I'll get you to the right person.
All right. And then we're going to do one more question so we can kind of get to our next before we wrap up. Are there studies about not spaying at C-section that we can print and take to emergency vet who want to spay at C-section or won't do a C-section without it?
Well, unfortunately, the AVMA published an article that said it was safe. I, however, wrote a 5-page document because I was really upset one day. I just went off and wrote a 5-page document. If you email me, I'll send it to you. Is there a published study? No, it's actually contrary because, you know, you can publish whatever you want. But I personally have seen too many disasters. So I just flat out won't do it.
All right. If we can get to the next slide. All right. Thank you, Dr. Greer. It's always such a great opportunity to be able to listen and learn from you.
This went
As a,
fast.
I did. An hour and a half went by so fast. As a sponsor of today's panel, I want to take a moment to tell you a bit more about ProPlan Breeder Program. Pro Club is a loyalty program for breeders offering great benefits and is the #1 choice of Canadian dog breeders. We have newly launched the Pro Club Platinum for responsible breeders to get rewarded for their Pro Plan recommendation to new pet owners. To upgrade to Platinum, log into your Pro Club account, upload your breed specific related health testing, which can be your dog's OFA link or the original copies, whatever's easier. You would hit the minimum purchase spend and then order your puppy kits and have a nutritional conversation with your new pet owners. The health testing is a one-time submission for approval, so there's no ongoing requirement for adding new breeding dogs to your program. For each litter of kits, you're going to upload a vet record within 30 days of the listed go-home date to unlock those owner bonus bag referral credits. So Platinum breeders can receive a $70 or 700 Pro Point credit for their new owner referrals. You're going to get the bonus for each owner who repurchases just 1 bag of Pro Plan after receiving a breeder starter kit, which is going to be tracked through the $10 kit coupon. As a member, we offer 3 easy ways to save on Pro Plan, as you can see here on the slide, through bulk delivery in most regions of Canada, online rebates, or we have an in-store discount at PetSmart. Next slide, please. And our puppy kits shown here, they include a box of Fortiflora for each new pet owner, a coupon for a free small bag, a full size, not a sample, coupons for 3 free wet cans of Pro Plan, and $10 off their next Pro Plan bag. So if you're a Platinum member, it's going to be linked to that coupon. Plus, each litter that you order puppy kits for, you as the breeder are also going to get a box of Fortiflora when you order your kits. To learn more, you can contact us or you can sign up online. You can visit purina.ca/proclub, or if you opted to hear in from a Pro Plan breeder representative when signing up for this panel, I will be following up with you in the next couple of days, so look out for that email. And now I will turn it over to Miranda to tell us a bit more about the Breeders Cupboard. Personally shop there. I told her just before we started this that I built a cart this morning and I'm going to have to hit checkout because I already got my reminder.
Thank you, Sarah. So we have pretty much everything you could need for breeding. If you are ever on our website and you're lost, we're always happy to help. Just give us a call or an email and we will help you out to decide what the best products are to get you ready for your whelp. I really appreciate you guys all coming. It was fun. I always learn something from Dr. Greer. It doesn't matter how many webinars I sit through, I learn something new every time. So thank you so much for doing this. And I have a coupon here for you guys to save on your next order. Use the promo code PLAN10. It's going to work on whelping boxes, progesterone machines, everything but our ultrasound machine. So take advantage of that on some of those purchases. It'll help every penny you can save.
Yeah.
All right. And then we have our learning center. So if there's anything that you're looking for, we have lots and lots of material in there. There are webinars, there's videos, there's articles. And if there's something that you feel like you want something to know about, then please let us know. And we'll add it as a blog, we'll add it as another article. We've done videos. I'm going to be there on Friday this week to put together some more materials. So please don't hesitate to let us know. So we want to thank everybody. It's been a great crew to put together this team, and we now have a whole line of equine products as well. So Revival's really been growing and doing some pretty amazing things.
Awesome. Well, thank you everyone so much for joining us tonight. And this webinar has been recorded, so it'll be up on our webinar playlist channel on YouTube. All right.
Yeah,
Have a good
so
evening,
thanks,
everyone.
Wonderful.
thanks to
Thanks,
Allison.
everybody.
Good night.
Thanks, Pro Plan.
Bye.